Hello, I'm Nancy Dole. I'm the registered nurse in the LGBTQ Clinic here at the University of Iowa, and I would like to instruct people on how to give themselves an injection. Today I'm going to show testosterone. My buddy here is going to be my patient, and I will show you the basic setup on how to do this. If you have questions, please let us know, and we'll give you the website at the end of this video so you can refer to that to get more information. So the number one thing you start out with is get all of your things together. And I'm going to clean my hands and put on gloves. At home, I just want you to wash your hands. You're not going to put on gloves. So this is, to me, it's a simple procedure. To you, it's going to be a little more involved, and that's because you're the one that's going to be doing the injection. So we're going to start with the testosterone. And testosterone comes 200 milligrams per milliliter, and I'll explain more about that. When you open your packages, I recommend you take the paper all the way off, set it plastic side down. If you leave the paper on, it might tip onto the floor and then you'll have to get a different piece of equipment. I have two different syringes here, so I can show you the ones that your pharmacy might give you. So the doctor will give you prescription for your medication, for your needles, and for your syringes. So I'm going to open my alcohol swab. I've got two different needles here. You'll get two different needles. I recommend you even open your Band-Aid. And today we're using Batman Band-Aids. You can have boring Band-Aids if you want, but I think you deserve a little color. Now, one of the hard things is to get this cap off of this vial. People like to take it off up, but don't. Take it, turn it to the side. So turn it to the side, and that's how you get this off. You will not put it back on again. Take your alcohol swab, clean the top of this off to the count of 10. And then there are two different syringes. This one, if you can, hopefully, is a 3 milliliter syringe. Some of you will have a very difficult to draw up amount in this syringe. So I recommend you will get then a 1 milliliter syringe. And that's the easiest one to use for most of the testosterones. You're going to get a larger needle, probably a 22 gauge needle, which is black, and that's what you're going to use to drop the medication. If you're going to give it to yourself in your muscle, you're going to use a 23 gauge needle. If you're going to give it to yourself in the subcutaneous tissue, you're going to use a 25 gauge needle. So the needles are measured just like wire. So the larger the number, the smaller the wire, or the smaller the needle. So you have to give yourself, you have to put the same amount of air in the syringe as the medication you're taking out. When you take this cap off, give it a good tug, because if you give it a small tug, you might ricochet back and poke your thumb. So my buddy here takes a 1/2 milliliter. And a 1/2 milliliter is 0.5 in this syringe. I recommend that you keep your vial on the table because you're going to be shaking. Pierce the top of it, put the air in, and then you're going to start pulling up the medication. Make sure your needle is under the liquid. This holding on to all of this takes a little practice, so don't worry about it if you fumble and bumble. Now, testosterone and estrogen both are an oil-based medication, and that is so they can release slowly throughout your body between injections. It takes a long time to get in here, so if someone who, like, for example, uses insulin, they'll be very surprised to see how long it takes to get in. So we're going to pull it back until we have enough, and then I'm going to get rid of the air. There we go. It's right on 0.5. Pull this off, set it down. Very, very, very carefully, put this cap back on, and this syringe, it turns on and turns off. This is a safety needle. After I give the injection, I'll show you how to take care of it. This one turns on, go ahead and turn on nice and tight. So to figure out where you give it to yourself, you want to put your hand in your groin. You're going to put it right in where your leg meets your groin, and I'm going to put my hand on the knee. So this area right here between our two fingers is the area I will give the medication, the injection. I'm going to clean it. I like to wipe this alcohol off because sometimes it burns when you get it. Again, pull this off with an exaggeration. I'm going to grab a hold of his leg. Now, his nerves are concentrating on my fingers pushing on it, and then I just gently slip it in. I pull back a little bit to make sure there's no blood, and then I inject it. You can't inject it fast because the oil will not let you do it. Pull it straight out. As a safety needle, you push it up with your thumb and it covers the needle. Now, no one can get poked with that needle. Because this is, now comes the hard time to figure out where I gave it to him. I think that's it. I think so too. You can actually massage this in just a little bit. It's not bleeding at all. Do you want a Band-Aid?
Sure.
Okay. So if you get a little bit of oil back, a little bit of blood, don't worry about it. The little bit of blood means that you nicked a capillary. It's not gone in the vein. If you ever see a little bit of blood in the syringe, take it out, change your needle, and give it to yourself in a different spot. If you're going to give this self to yourself subcutaneously, it's a very small needle, very short, same measurement. It's going to be the side of your leg. You're going to go straight in and give yourself the medication exactly the same way. Again, push it up with your thumb to make it off, and you're done.